Here, I want to talk about brainstem stroke syndrome. That's very important in clinical settings, but it's not easy to identify the site of lesion. It is not very easy to memorize the complex structures in the brainstem. So to make it easier, we need to know the roots of all. In roots of all, there are four roots. So we need to memorize that before going to brainstem stroke syndrome in a clinical setting. There are four structures in the midline which begin with M, four structures to the side beginning with H, four nuclei in the medulla, four nuclei in the pons, four above pons, two in the midline. And I'm going to depth into that in the later slide. Okay, four motor nuclei in the midline are those that divide equally into 12, except for 1 and 2, that is that 4, 6, and 12, and 5, 7, 9, and 11 are in the lateral brainstem. So to make it clear, let's see with that. So here, there's anatomy of our brainstem. In the midbrain, there are 3rd and 4th cranial nerve. In the pons, there are 5, 6, 7, 8 cranial nerve. In the medulla, there are 9, 10, 11, and 12 cranial nerve. So we need to memorize that. Okay, so here, I draw the diagram for that brainstem to make it clear. Okay, four motor nuclei that's in the midline, those divide equally into 12. You see that? That 4, 6, and 12. 1, 2, 3, 4. Right? Except for 1 and 2, because 1 and 2 cranial nerve, light, olfactory, and optic end up in the brain and not in the brainstem. Okay? And then 5, 7, 9, and 11 are in the lateral brainstem. 5, 7, 9, 10, 11. Right? Okay. So this is an important thing. We need to memorize that. Okay. Here, in the midline, there is 4 nuclei that divide equally into 12. And here is the 4 midline structures which beginning with M. And these are motor pathway, and damage to it can lead to contralateral hemiplegia. And damage to mediastinal lemniscus leads to contralateral loss of vibration sense of proprioceptions. And other M is medial longitudinal fasciculus. Damage to it can lead to internuclear ophthalmoplegia and motor nuclear, as I mentioned above, right? So we need to memorize these 4 structures which beginning with M. Here, there's also another important thing. We need to memorize that. These are the side structures which lie laterally in the brainstem, which beginning with S, light spinocerebellar pathway, and affect and damage to it can lead to ipsilateral ataxia of the arms and leg, and damage to spinothalamic tracts lead to contralateral loss of pain, touch, and temperature. And also there is sensory nucleus of 5th cranial nerve, and damage to it can lead to pain, loss of pain, touch, temperature on the face. And also here is a sympathetic pathway that's lying laterally in the brainstem, and damage to it can lead to Horner syndrome. Okay. Another 4 roots is 4 cranial nerve above the pons. That means olfactory, optic, oculomotor, and trochlear nerve. But olfactory and optic nerve end up in the brain and not in the brainstem, so we don't need to memorize that. We need to memorize oculomotor and trochlear nerve, which is in the midbrain. Okay. So another 4 cranial nerve in the pons. These are trigeminal, abducens, facial, and auditory nerve. So we need to memorize that. Okay. Another 4 cranial nerve in the medulla, it's like glossopharyngeus, vagus, accessory nerve, and hypoglossal nerve. Okay. These are the theory about the brainstem structures, and it can easy to identify with the rules of 4. Here, we go to our clinical settings and how can we examine our patients. Let's start with that. Here, 4 midline structures beginning with M and the 4 side structures beginning with S pass through the entire length of the brainstem. Like that, it can be linked to meridians of longitudinal, whereas the various cranial nerves can be regarded as parallels of latitudes. Here is latitudes. In the latitudinal lines, there will be cranial nerve. In the longitudinal line, there will be 4S and the 4M. Okay, so it's very easy to identify our brainstem stroke lesions. Okay, here is the various type of brainstem stroke syndrome, and then they share the various complex anatomy, right? These are the Weber syndrome, Claudius, Benedict, Knocknagel, Bernot, Mallet-Gabler or Gabler, and Wallenberg syndrome. Okay. Let's see one of the examples of Wallenberg syndrome. In case of Wallenberg syndrome, these are the clinical features that can be seen in the Wallenberg syndrome, like ataxia, loss of pain touch temperature, weakness of soft palate, larynx pharynx, and loss of pain touch temperature, and Ono syndrome. Why? So it's very easy to identify because it affects the posterior inferior cerebellar artery, which supply the lateral of the brainstem. So, in case of Wallenberg syndrome, there's lateral structure beginning with S, like spinocerebellar pathway, and damage to it can lead ataxia, and spinothalamic threads damage to it can lead to loss of pain touch temperature on the contralateral side, and sensory loss of fifth cranial nerve. Damage to it can lead to loss of pain and temperature of face, and also sympathetic pathway. Damage to it leads to Ono syndrome. Okay, these are the 4 side structures, and also there's some cranial nerve lie in the medulla laterally. These are 9, 10, 11. So damage to that can lead to weakness of soft palate, larynx, and pharynx. So it's very easy to identify, and it's very to memorize stroke syndrome, right? Okay, here's another example. Is Weber syndrome. That affects the cranial nerve, full cranial nerve, and contralateral motor weakness. Let's see that. In case of Weber syndrome, it affects the midbrain. So in midbrain, they are that and full cranial nerve that's lie medially. So here, damage to that cranial nerve leads to that cranial nerve palsy, damage to fourth cranial nerve palsy. Also, there are 4 midline structure beginning with M, motor pathway that lead to contralateral motor weakness. Also, there is damage to medial lemniscus leads to loss of vibration sense proprioceptions. Medial longitudinal fasciculus leads to internuclear ophthalmoplegias. Okay, these are the example of our brainstem stroke syndrome, like Wallenberg and Weber syndrome. Okay, today I'm going to talk about the importance of brainstem stroke syndrome. So in a later video, I'm going to talk about the importance of clinical importance of some diseases. So please subscribe my channel. Let's see in the next video. Thank you.